Who would have thought that Jamaica's healthcare system would survive the COVID-19 pandemic? Well, it did. Jamaica's healthcare system did not collapse during COVID, even to my surprise. I honestly thought that COVID-19 would wipe out our healthcare system. Well, the government of Jamaica has finally erected a monument to remember those we lost in COVID and those who served during COVID. 5 years later, this is the memorial site of this historic pandemic in Jamaica's history. JPU family, thank you for stopping by. I want you to have a listen to the speakers who were at the ceremony, from the health minister who served during COVID, the chief medical officer, the prime minister, and other members of the healthcare profession.
Thank you very much, Dr. Jacqueline Biseso Mackenzie, CD, Master of Ceremonies and Chief Medical Officer. Dr. the Most Honorable Andrew Holness, ON, PCMP, Prime Minister of Jamaica. Mr. Mark Golding, Leader of the Parliamentary Opposition. The Honorable Fable Williams, I don't see her, but she may be on her way. Ms. Nicola Brown, Director of Nursing Services, National Chest Hospital. Other distinguished ladies and gentlemen who are in the audience, good morning to you all. We gather today to remember and to honor with deepest thanks the commitment and sacrifice of the healthcare workers we lost to COVID-19. This monument, a structure made of concrete and of steel that we are to unveil momentarily, stands as an enduring symbol of their dedication, but also of their bravery in service to the people of Jamaica. You may recall, ladies and gentlemen, that the experience of COVID-19 was at once terrifying and uncertain to us all. Yet these men and women, our healthcare heroes, all put their lives on the line, pushing through the fear and through the uncertainty to preserve health and to save the lives of others. Each name etched on gold plates and mounted on porcelain tiles represents a life of service. These were doctors, nurses, male attendants, patient care assistants, mental health officers, cooks, midwives, cashiers, all healthcare workers who put service above self and who made the ultimate sacrifice. These workers stood by bedsides and encouraged patients when their loved ones could not, prepared meals, delivered babies, sanitized facilities, looked after the well-being of all. They went above and beyond the call of duty, for which we should be eternally grateful. To their loved ones here today, there are no words to fill the void that they have left behind. I trust, however, that you know that while your loved ones, our colleagues, may be gone, they will never be forgotten. What is more, their legacy endures in the lives that were saved through their efforts, in the memories of the moments shared on and off the job, and in the inspiration that fuels our efforts as a Ministry of Health and Wellness and as the government of Jamaica to continue to honor and to celebrate these healthcare heroes. This near 10 feet tall monument, which you will see momentarily, is not merely a memorial. It is also a promise to continue to honor the sacrifice of our healthcare heroes by building stronger healthcare systems and continuing to support those who serve on the front lines. It is my hope that this place can be one where reflection happens, where we are reminded to be grateful, and where we recommit ourselves to realizing a better future in public health for all at all ages. Further, and perhaps most importantly, I trust that it can be a place where the heroes we lost are always remembered and their sacrifices always honored. Thank you.
I think every life saved during COVID was a miracle. And unfortunately, some persons were lost as a result of us saving those lives. And I believe, Prime Minister, Minister, we move mountains. So I really think very appropriate. I got goosebumps when I was listening to your song. Thank you so much. This occasion and date, do we know what date it is? March the 10th. Always will hold a very significant place in our minds when we hear that date, March the 10th. It marks the 5th anniversary of the first confirmed case of COVID-19 in our nation. And we tied in the vaccines, so it's actually the 4th anniversary of the commencement of the administration of the vaccines. This moment, we hope, will serve as a lasting tribute to the healthcare workers who made the ultimate sacrifice during the pandemic. I want to thank our Prime Minister and our keynote speaker, Dr. the Most Honorable Andrew Holness, ONPC MP, for his presence at this occasion and his leadership during the pandemic. Ladies and gentlemen, it is my distinct privilege to invite our keynote speaker, Dr. Andrew Holness, Prime Minister, to address us.
First, let me commend the National Public Health Lab Ensemble. I forgot that they were medical professionals for a moment because they performed so well. And let me acknowledge your Master of Ceremony, the distinguished Chief Medical Officer, Dr. Jacqueline Bisesa Mackenzie. And I do recall the night of the 9th of March, 5 years ago, when our Minister of Health, Dr. Christopher Tufton, made that fateful call to me to alert me that we could potentially have our first case of COVID-19. I had always prepared myself for that call since we first got note of this brewing pandemic in February of 2019. And so it didn't come as a surprise. But you know, there are things that you know it's going to come, but you still feel, you know, almost like a gut-wrenching pain when it was told to me that, yes, Jamaica had its first case. There was no panic, but like everything else that it is unknown and uncertain, you had a kind of foreboding sense. But the administration steeled itself. We were prepared, and we were able to mobilize and address the challenge in a very creditable way in almost all aspects of the management of the pandemic. So I believe that today's function is a fitting recognition for the people who served and who sacrificed. So let me further acknowledge Mr. Mark Golding, Leader of the Opposition. Minister Favour Williams, I'm sure, would have been here were it not that she is preparing her budget presentation. Let me also acknowledge Dr. the Most Honorable Denise Eldermeyer Shearer, the Executive Director of the Mona Aging and Wellness Center. And let me also personally commend you. You played a critical role in caring for our seniors during COVID, and at the same time, giving advice to the government about what we should and should not do. And if I may, at this juncture, say to our seniors who faithfully abided by the stay-at-home rules, I know some of them complained bitterly, but they complied. And I believe because of that, we were able to have a very low rate of impact of the pandemic on our seniors. Let me acknowledge the representatives from the various ministries and agencies who are here, members of the diplomatic corps who are here, our specially invited guests, especially our healthcare workers and the families of the heroes that we salute today, members of the media, ladies and gentlemen, it is indeed a good morning. Today, we gather in solemn remembrance and profound gratitude. This monument, which we will unveil together, is not merely a structure of stone and metal. It represents the courage, dedication, and sacrifice of the healthcare workers who stood on the front lines during one of the most challenging periods in our nation's recent history. When COVID-19 reached our shores 5 years ago, bringing uncertainty and fear, it was our doctors, nurses, patient care assistants, hospital attendants, technicians, support staff, and other healthcare professionals who rose to the occasion. In the face of overwhelming odds, that is the most devastating pandemic in a century, they stood firm on the front line, in our front line of defense, and did not falter. They put their duty above their fears, their patients above their own well-being, and in doing so, they saved countless lives. Today, we pay tribute not just to their service, but to their selfless sacrifice and unwavering dedication. We honor those who did not return home to their families, those who gave their last measure of devotion in the line of duty, those whose names are now etched on this monument so that generations to come will remember their heroism. We must always remember that these are names of mothers and fathers, sons and daughters, friends and colleagues. They were Jamaicans who gave everything to protect their community. As a nation, we owe them more than a monument. We owe them a commitment to never take for granted the sacrifices by those who serve. We owe them our dedication to strengthening our healthcare system, ensuring that our families, workers, are never placed in harm's way without the resources and support they need. We must build a stronger future for Jamaica in their honor. And to do this, we must strengthen our economic resilience. Now, some may wonder why at times economic matters seem to dominate our national conversation, or why is it that I bring economic matters into all elements of our national conversations? Well, the answer is that economic resilience translates to resilience of every aspect of our governance, including our healthcare system, in our education system, in our security forces, but most importantly, in our ability to respond to crisis. If our economy isn't doing well, we cannot respond adequately and effectively to crises. The pandemic exposed vulnerabilities that we have since worked tirelessly to address. Because of the difficult but necessary economic reforms we have undertaken, Jamaica is now better prepared for future shocks, whether it is another pandemic, a natural disaster, or a global economic downturn. Today, our healthcare sector is stronger. It is stronger in terms of the infrastructure. It is stronger in terms of the number of professionals that we have. We still need to pay some attention to remuneration and care. Yes, I'm seeing the nods, not hearing the claps, but... So I know it's a statement for which there is some amount of agreement. But we're working on both. Remuneration, for which the professionals will be very interested in. But the general public is also interested in the care element, for which the professionals are also interested. And I think we're going to have this open conversation about care in healthcare, because it is really a challenge for many Jamaicans. It's a difficult conversation because you always have to be paying attention to the remuneration, to the infrastructure, to the facilities, to the supplies and resources. But, you know, care is from the heart. And I think what the public is saying is that we need to see more heart in healthcare. That's, I think, is a good synopsis of the public position. But, of course, the balance is always that the professionals need resources and proper remuneration. And I think the government understands this delicate balance, and we're trying to do both, which is why a strong economy is so important. I think I've made that point.
I invite our distinguished guests to join in unveiling of the monument, led by our Prime Minister, Professor Shearer, our opposition leader, Mr. Golding, and Minister. So we will move over to the monument to unveil and to lay the tributes.